Today, our subcommittee is considering 5 bills to reauthorize. They're important public health programs that support and improve the health and well-being of children in our country, as well as adults. While so much of our subcommittee's focus and work is on the COVID-19 pandemic that has taken the lives of 150,000 Americans, we also have to continue our essential work during the crisis, which means making sure that health programs nearing their expiration are continued, that they are improved, and in some cases, expanded. So today we're going to hear testimony on 5 bipartisan reauthorization bills. Several of these bills support individuals in the fight against cancer. The Creating Hope Reauthorization Act, sponsored by Representatives Butterfield and McCall, help children access pediatric cancer drugs. Pediatric cancer is the #1 disease killer of American children, but pharmaceutical companies often avoid developing pediatric cancer drugs because of the very small market and the high risks that are associated with studying and testing drugs for children. The Creating Hope Act provides incentives for the research and development of pediatric cancer drugs by providing the developers with the valuable priority review vouchers, which allow the recipient to speed up the FDA review of any one of its new drug products. The next bill, the Transplant Act, sponsored by Representatives Matsui and Bilirakis, helps those with blood cancers like leukemia and lymphoma to be matched with a potential bone marrow and cord blood donor. Through this matching program, over 100,000 lives have been saved. So clearly, this works. And that law is a source of pride to all of us. The Early Act, sponsored by Representatives Wasserman Schultz and Brooks, increases funding for the successful CDC outreach and education campaign that informs young people about breast cancer risks. Each year, over 300,000 women are diagnosed with breast cancer. I've spent my entire service in Congress to make sure women have access to breast cancer treatment, including reconstructive surgery after mastectomies. And I'm really pleased to consider this important program today. Now, outside of public health programs that help in the fight against cancer, we're also considering a bill to reauthorize the school-based health center program sponsored by Representatives Sarbanes and Stefanik. About 2,500 school-based health centers serve 3.6 million American children. These health centers provide children with immunizations, mental health support, asthma and allergy screenings, and many other vital services. It really is a terrifically effective program. And finally, we're considering a bill to make sure that the U.S. Anti-Doping Agency is prepared for the 2028 Olympics in Los Angeles. The sponsors are Representative Mike Thompson, Diana DeGette, and Mr. Johnson. The agency is an independent body that manages the anti-doping program for America's athletes to ensure they're playing clean. So as we struggle with the pandemic, with COVID-19 and the crisis that it is in our country, we have to keep up our work for the American people, those with cancer, our nation's children, and our athletes training for future events. And that's exactly what we're doing today. So I stand ready to work with each of you to make sure that these programs are reauthorized